How to know when your cat needs help. How well do you know your cat? Cats are known for being independent and mysterious, but when it comes to their health, it's important to pay attention to their behavior. They may not be able to speak to us, but they do communicate in their own way. In this video, we'll go through 16 signs that your cat is in pain or discomfort and needs your help. Make sure not to miss out on any of these important clues because your cat's well-being could depend on it. 1. Increased hiding. If your cat is hiding more often than usual, it may be an indication that something is wrong. While cats are known for their love of hiding, sudden and frequent hiding can be a sign of pain or illness that may not be visible to the naked eye. It's important to pay attention to your cat's behavior and seek veterinary attention if you notice such changes. 2. Not using their litter box. When your cat suddenly stops using their litter box and starts relieving themselves in other parts of your house, it could be a signal that they're feeling unwell. These litter box problems can be a result of various health issues such as kidney disease, bladder stones, or a urinary tract infection, and it's important to take your pet to the vet as soon as you notice this type of behavior. 3. Changes in maintenance habits. Cats are famous for their excellent grooming habits and keeping a clean coat, but if your feline friend starts neglecting their appearance, it could be a sign that they're feeling unwell. Your cat may be experiencing fatigue, which can result in a disheveled look or a lack of grooming. This can manifest as missing patches of fur, debris stuck in their coat, or feces stuck to their rear end. In such cases, a checkup with the vet may be necessary to address any underlying health issues. 4. Discolored gums. In order to maintain your cat's health, it's important to regularly check their gums. A healthy gum should be a deep pink color and return to that color within a few seconds after being pressed. But if your cat's gums lack color, this could be a sign of blood loss or poor circulation. Additionally, bluish gums may indicate a serious lack of oxygen, while bright red gums may indicate toxicity or overheating. If the redness is located above the teeth, it may also indicate a dental issue. By keeping an eye on your cat's gum color, you can help detect potential health issues early on. 5. Stinky breath. When your cat has unusually foul breath, it could be an indication of gum disease or tooth decay. The hundreds of bacteria that reside in your pet's teeth can cause bad breath, and you can reduce the risks by maintaining good dental hygiene. Brushing their teeth and taking them for an annual dental cleaning can help to minimize the risks. 6. Drinking excessive amount of water. Cats typically don't drink a lot of water, so if you notice that your furry friend is draining their water bowl quicker than usual, it might be a cause for concern. A cat who drinks a lot of water may be experiencing an endocrine disorder like diabetes or hypothyroidism, or it could indicate the onset of kidney disease, which is more common in older cats but can also affect younger ones. 7. Sudden increase in appetite. If you notice your cat is eating more than usual, it may not necessarily be a good thing. In fact, it could be a sign that your furry friend is unwell. A sudden increase in appetite can be an indication of underlying health issues such as diabetes, hyperthyroidism, or nutrient malabsorption, and it's very important to have your cat examined by a veterinarian if you notice a significant change in their eating habits. 8. Crying or yowling. If your cat is in pain, they may cry or yell, which can be a sign that they're not feeling well. You can tell if something is bothering your cat when you try to pet them and they whine or keep their distance from you. 9. Vomiting. In general, occasional vomiting or hairballs are normal for cats, but it's a cause for concern if your cat vomits once a week. Frequent vomiting could indicate an underlying health issue, and if you notice your cat started vomiting too often, it's important to take your pet to the vet to determine the cause. 10. Increased aggression. When your feline friend starts behaving differently, it could be an indication that they're sick. Pain can cause a cat to become aggressive, especially if you touch a sore spot without knowing. 11. Losing hair and crusty skin. If you notice your cat losing an excessive amount of hair and you observe crusty or scaly patches on their skin, which may appear red, it's essential to take them to the vet for a checkup. Hair loss can be an indication of skin disease, a vitamin deficiency, an allergy, or stress overload. In some cases, these are signs of ringworm, and it's crucial to have your cat examined by a veterinarian. 12. Unexpected weight gain or weight loss. To keep your cat healthy, it's important to monitor their weight, as sudden gains or losses can be a warning sign of underlying health issues. Even small fluctuations can be significant for felines, as gaining or losing just 1 pound is equivalent to a human gaining or losing 10 pounds. While weight loss is typical in older cats due to muscle loss, extreme changes can signal something more severe, such as cancer. So it's crucial to keep an eye on your cat's weight and visit the vet if you notice any unexplained variations. 13. Lack of appetite. If your furry feline has lost interest in their favorite treats, it may be a cause for concern. A loss of appetite is a sign of a serious underlying issue, such as an infection, kidney failure, fever, or even cancer. So if you notice a significant decrease in your cat's appetite, it's important to get them checked by a vet. 14. Mobility problems. If you notice that your cat is walking stiffly or limping, it could be a sign that something is not right. In younger cats, this might suggest an injury, while in older cats, it may be a sign of arthritis. 15. Change in sleeping patterns. If your cat's behavior changes from being active during the day to sleeping all day, or from sleeping all night to being active, it may be a sign that they're not feeling well. These sudden changes in behavior could be indicative of an underlying issue that requires attention. 16. Runny eyes and nose. Just like humans, cats can also catch a cold, which is known as a feline upper respiratory tract disease. If your cat starts sneezing, coughing, or has a discharge from their nose or eyes, it might be a sign of this disease. A clear discharge from the eyes might be due to eye irritation or a clogged tear duct. However, if the discharge is green or yellow, it's likely a sign of an infection and needs medication from a veterinarian. Red and runny eyes could be a sign of a cat's pink eye, which can be caused by dust, infection, allergies, or even feline herpes. This brings us to the end of today's video. Don't forget to like and subscribe, and make sure to hit the bell button so you can get notified whenever there's a new video ready for you and your furry friend to watch.